All right. So, given that it is our first ever doula office hours, I just want to briefly kind of introduce the purpose of what these regular doula office hours will be and is. And it's really just a support system for our doulas. We recognize here at Contra Costa Health Plan the great value that doulas bring to our members and health outcomes. So, we just want to make sure that our contracted and prospective doulas are fully supported, whether that be with answering questions or giving them help when needed, and making sure that this partnership is kind of as smooth and easy as possible so that doulas can primarily focus on delivering their service. And this is just one of kind of a few initiatives that we've got currently going on to support and uplift our doulas and continue improving health outcomes for our community. And with that being said, one of the first things that doulas have to do in order to be able to provide our member services is become contracted with CCHP. And for that, we have Terry, who is the Director of Provider Relations, here to talk a little bit about credentialing, contracting, onboarding, those processes, the qualifications a doula must have in order to be contracted with CCHP, the hospitals that we work with, briefly explaining how to submit a claim, and then we'll open the floor if there's any questions that anybody might have that hopefully Terry can answer. And if not, we'll try to see how we can get those answers. And at the very end, I do just want to briefly mention again to those who might be unaware of the new billing requirement with the Department of Healthcare Services. But with all that being said, I'll open the floor to Terry to kind of introduce provider relations and everything that encompasses them.
Okay, great. Welcome, everyone. My name is Terry Leader. I'm the Director of Provider Relations, Contracts, and Credentialing at the Health Plan, and we're very pleased to have you joining us today, as well as this being a newer benefit for our Medi-Cal members. So we've been very excited to reach out to as many doulas as we can to try to get them onboarded and credentialed and contracted with us for services. Going to just briefly start out. If you're already contracted with us, you have contacted us and are aware of this process. But for those that are prospective, basically, some of the first things is that you have to have a national practitioner ID number and be registered with the Secretary of State to conduct business in California and have proof of liability coverage. And that's prior to initiating the process with us. And if you're a prospective doula with the health plan and don't already have some of these requirements, we are able to assist you in directing you to the NPI website and how to apply, and then also where the Secretary of State is. So I know sometimes that's a little bit challenging for people who are new to this process. So we can assist you with that. When all of that is in place, you can reach out to the health plan, our CCHP contracts at cchealth.org, and submit a letter of intent just stating, hi, I'm a doula and I'd like to be contracted with Contra Costa Health Plan to deliver services, and then we can start the process. And generally what we do is we send you out a pre-screen form that just asks a little bit about information about yourself and where you're located, and then also provide you information about the reimbursement for doulas, and to send you our really streamlined credentialing application. One of the things that we also do is we have like a new provider information sheet, which we send out, and that informs you how to set up access to our web portal, which you'll be able to use. And it's very extremely helpful when you're looking for member eligibility or to submit claims, and then also how to sign up to be able to submit claims electronically and also for electronic payment. So saying all that, it seems like it's very complicated, but in essence, it's really not that complicated, and we walk you through the process. And once we get all that taken care of, we get the forms we need back from you to start the process of getting a contract and credentialing with us. we would put your applications through our peer review credentialing committee and get you active in our network so you can start seeing our members. It generally takes about 1 to 3 months just because of all the paperwork involved. We try to shoot for 30 days, but sometimes it takes a little bit longer than that. Any questions so far? Okay, hearing none. So the minimum qualifications, you must be 18 years old, possess an adult infant CPR certification, have completed basic HIPAA training, and have either the training or experience pathway. So these are two of the pathways that are extremely important when it comes to moving forward with being a doula in our network. And I know that some of you, if not all, have also gone through the DHCS training, and we get lists on a monthly basis from the Department of Healthcare Services to show who are providers that have been, I guess, if you will, credentialed or certified by DHCS, and those providers that we actually proactively reach out to, as well as those that come to us through our contracts database. So the training pathway, you have to have a minimum of 16 hours of training in the following areas: lactation support, childbirth education, foundations on anatomy of pregnancy and childbirth, non-medical comfort measures, prenatal support and labor support techniques, developing a community resource list, and provide support at a minimum of 3 births. So that's one area. And then the experience pathway, or all of the following, as it says here, have at least 5 years of active doula experience, either paid or voluntary, within the last 7 years, attestation of skills in prenatal, labor, and postpartum care, as demonstrated by 3 written client testimonial letters or professional letters. Letters must be within the last 7 years and have 3 hours of continuing education in maternal, perinatal, and/or infant care every 3 years, and maintain evidence of completed training to be made available to DHCS upon request. So on our credentialing applications, again, it's very streamlined. Basically, what we do on there is just ask you to do an attestation that you are qualified in either of these areas, pathways, training, or experience. Any questions so far? No. Okay. You're making it very easy for me. I know this is the first one, but it's great. Okay. So here's our next slide is our contracted hospitals. So these are hospitals that we have a contract with, and the majority of our members would be giving birth at these, either have uh, made arrangements previously to have their deliveries there, or sometimes there may be times when it's an emergency and they end up going to a different hospital based upon the circumstances. But anyway, saying that, we are contracted with the 2 Alta Bates in Berkeley and Summit, our own Contra Costa Regional Medical Center, the John Muir Concord and Walnut Creek. And I know that Walnut Creek is the hospital where they do the deliveries and have prenatal and postnatal care in the prenatal, or excuse me, not prenatal ICU, but the neonatal unit there in the NICU. Stanford Healthcare Valley Medical Center, which is in Pleasanton, Livermore area, Sutter Delta in Antioch, Sutter Solano in Vallejo. And we are contracted with the UCSF Benioff. I'm not sure that they do any deliveries there, but there may be occasion where you might be there. Any questions on our contracted hospitals? Okay, moving on. Okay, so claims. For many of you, you might not have ever submitted a claim before to a health plan, so this may be a whole new process. Our claims unit accepts claims on what they call a CMS 1500, and those can be submitted to us through a clearinghouse, which is we use Ability. And as I mentioned before, when we first started out, we give you the information so that you can register with our clearinghouse. It's free. There's no cost to you to be able to submit your claims electronically, or you can submit them electronically through the web portal. or you can submit them by mail. My recommendation is that you try to do it if you can through the clearinghouse or electronically. If you don't have the ability to do that, that's fine. We do accept them by mail, but I think you might find it easier if you've not submitted claims before to do it electronically, because it's sort of built in the system to where you could go in and just enter the information. And it's pretty self-explanatory. And if you have issues with that, we can always have our claims team reach out to you and assist you with that process. And then once you submit the claims team has 45 business days for the claim to be processed. In general, if it's a clean claim, meaning everything's fine with the submission of the electronic claim, they pay much quicker than that. And especially because you're contracted, the information's already in our claim system. In general, if there's no claims problems, if there's no claims problems, then it pays right away. It just goes through the system and can pay much sooner than the 45 business days. Okay, yeah, let's see. And questions and answers. I know that's really quick and just an introduction. Um, any questions?
Yeah, thank you so much, Terry. I know that you briefly mentioned the provider directory that the state
Hmm.
puts out, DHCS,
Hmm.
and sometimes there's some disparities between our provider directory through CCHP and then the one at the state. You mentioned that it could potentially be that they just haven't reached out to us, or they're still being waited, we're waiting to be reached out to by us, or maybe they're in that period where they're waiting to be contracted. Is that usually the case then for those
Um,
disparities for those
For
two lists?
the doula list that we get from the DHCS on a monthly basis, we reach out on a monthly basis. Sometimes, in fact, like right now, we have several pending, meaning they're in the process of being credentialed and contracted. Like I said, it takes a minute. Sometimes what happens is that we will reach out to the provider or the doulas, and then we send them the forms, and then we may not get the forms back for a while, or they stop responding to us, and we will reach out a few times and then we'll stop after 2 or 3 attempts. For the most part, we get the forms back very quickly and we start the process. With the doulas right now, it's been a little bit of a challenge because again, it's a new process for them, and having to fill out the streamlined credentialing application, even though it's not as complex as for our other providers, it's still different. It's different, it's new, and then just trying to get them through the process. And then also sometimes there's just misunderstandings about the process. In fact, I had one, we have one that made an inquiry today because they thought that if they sent an email to ask to join the network, that we would be able to get them credentialed and contracted in 2 days. I'm not sure where they heard that, but that's okay. We are going to reach back out to them and said, thank you. Yes, we're happy to have you in network, but it's going to take a minute, and here's what you need to do to get started.
Great, thank you. And then while they're in this kind of process of becoming contracted with us, are they not allowed then to technically deliver services to CCHP members, or can they then maybe retroactively bill something, or can they just not?
Uh, See, that's a good question. I think that for our purposes, to be credentialed and contracted means that they've gone through the entire process. They've been validated to be able to do the services, and they're set up in the claim system to receive reimbursement. When we don't have the entire process in place, it makes it a lot more complicated. It's for the doulas to be reimbursed. I'm not saying entirely that they can't be reimbursed if they're not credentialed and contracted, but then it has to go really through an authorization because they're not with the plan currently, where I believe that doula service are not required to be, um, they're not required to be credentialed and contracted. They can get authorization, and we could do a letter of agreement. That's another way if they're already seeing a CCHP member.
So then essentially they can, but there might not be a guarantee then that they can be reimbursed retroactively.
Well, not necessarily. They would have to, if they have authorization and we do a letter of agreement, yes, they will get paid for all services. If they just send in a claim, it may pend and take a much longer to get reimbursed because they're not set up in the system for payment, and it's a little bit more challenging. That's why we try to encourage all the doulas to get credentialed and contracted.
Thank you. Does anybody else have any questions potentially for Terry or regarding these topics? So then, like I mentioned, I just wanted to briefly introduce the new billing requirement through the Department of Healthcare Services, just for those who might not be aware. Effective November 1st, doulas will need to include a diagnosis code on their claims for both fee-for-service and managed care delivery systems in order to be paid. The diagnosis codes just describe and identify what happened during the service. They're not being used for any medical or diagnostic purposes. And the Department of Healthcare Services actually came out with this billing crosswalk where it makes it a little bit easier to know which diagnosis codes are associated with which billing codes. And you can find that on the DHCS Doula Provider Manual. It has been updated for easy access. In case you have any questions about that. And then this PowerPoint I will send out to those who attended and make this available if anybody would like to reference this. But aside from that, that is the end of our presentation with provider relations. Thank you so much, Terry, for presenting and answering those questions for us and everybody who tuned in to just learn a little bit more. Like I mentioned, I did record this and hope to make it available to our doulas and prospective doulas so that they can refer back to this presentation with any kind of questions. But aside from that, if nobody has any final comments or questions, we'll end this meeting a little early today.
I just would want to follow up on what you said about the billing code. So we will be sending out the billing and diagnostic codes by Friday to all of the contracted doulas so that they will know how to bill moving forward after November 1. And then in addition to that, that will be in all the new contracts moving forward.
Great. Thank you so much, Terry,
Okay.
for that info. All right. Well, thank you everybody for joining, and I'll give you back some time on your Wednesdays.
Thank you.
Thank
Bye-bye.
you. Bye-bye.
Thank you.